Hello, everyone. If you're just joining us, welcome to today's Lunch and Learn. We're going to give it just a second or two to let everybody in from the waiting room, and then we'll get started. Hello, everyone. If you're just joining us, we are going to get started in just a minute here. We're letting people in from the waiting room. Okay, it looks like we have everybody here. Um, Hello, all. Welcome to today's Whole Health Louisiana Lunch and Learn. My name is Liz Skilton. I'm an Associate Director of Research at the Kathleen Babineau Blanco Public Policy Center and head of the implementation team for Whole Health Louisiana. We're excited to welcome you to today's Lunch and Learn for Whole Health Louisiana. WHL is a collaborative effort led by the Louisiana Department of Health as the public sector anchor and funder for the Whole Health Louisiana initiative. The Blanco Center leads the plan's implementation and evaluation. If you're unfamiliar with what Whole Health Louisiana is, Whole Health Louisiana is the state's cross-sector initiative intended to systematically address, mitigate, and prevent childhood adversity within our systems of care and support. WHL has 4 priority areas and goals: collaboration, awareness, workforce, and prevention and healing. With these priorities in mind, WHL's vision is to build a state where children, families, and community members across Louisiana are healthy and thriving, regardless of who they are and where they live. I'm going to turn things over to my colleague, Brooklyn, who's going to be the moderator for today's session and introduce our speakers. You'll also probably notice things kind of shifting around on your screen as we get ready to turn things over. So Brooklyn, please take it over.
Hey everybody, I'm Brooklyn Thibodeau. I'm a researcher at the Blanco Center at UO Lafayette. And like Liz said, I'll be moderating this webinar for today. As part of our initiative, we are holding a variety of different activities meant to raise awareness and deepen conversation about trauma-informed care practices. Our virtual Lunch and Learn series touches on the workforce priority area of the WHL plan and features presentations from industry professionals and subject matter experts. Our planned webinars for the future are on the Eventbrite page that you all use to sign up for today's event. And before I introduce our speaker for today, I want to first mention that the ASL interpretation for today will be led by Lissa Guild. You should see them pinned at your screen to view the interpretation throughout the webinar. In addition, if you are attending for CEU credits, please remember to complete the post survey to receive your credits. That link will be dropped in the chat shortly. Now, let's go ahead and introduce our speaker for today. Curtis Nelson has over 30 years of experience working with children and families. He has worked as an adolescent mental health technician in the mental health setting, a court-appointed special advocate, a family attorney for children in need of care and delinquency proceedings, a juvenile persecutor, and an administrator at the state level working with children and families. He's a veteran of the United States Army, having served 6 years with the Louisiana Army National Guard in the Combat Medical Unit, and 7 years with the United States Army Reserve, the Theater Support Command Judge Advocate General Corps. Curtis is a Baton Rouge native. He earned his bachelor's degree of psychology with a minor in sociology at Louisiana State University in 92, and he has a Juris Doctor from Loyola University School of Law in New Orleans, and he received that in 1997. Now I'm going to turn it to Curtis to take it over and present.
Thank you so much, Brooklyn, and thank you, Liz. And so I am now sharing my screen, so hopefully everyone can see our presentation today.
Yes, we can see it.
Perfect, perfect. So we're going to talk about the trauma-informed approach in the workforce when dealing with children in the court system, often referred to as the juvenile justice system here in Louisiana. And we're definitely going to get into the conversation of what things should be done to work with our staff. But I'm going to kind of do it a little reverse because we're going to talk about the children first and the system, and then we'll kind of end our conversation today on what does that look like with our staff and strengthening our staff. So let's get started. Uh, Disclaimer before I get really deep into our conversation. All the opinions and views that I'm expressing, these are my own personal views. I'm not here today representing a specific agency. Rather, my conversation with you is just everything I've experienced, entry level, all the way to overseeing some of the state agencies here in Louisiana. So this is my personal views. So let's get into our conversation, trauma in the juvenile justice system. Why is this conversation important? I believe it's important because when we look at the data concerning the juvenile justice system children, what we know is that a large percent of the children who come through the court system, they themselves have been exposed to trauma. And this trauma can include anything from physical, sexual trauma, witnessing domestic violence in the home, or just even witnessing violence in their own communities. The trauma and the connection to the children involved in the system, because of this exposure to trauma, oftentimes we see impacts on their academic achievement. Later on in life, they may even have the children who now are adults may have difficult as adults, so they may have difficulties in the workplace, as well as youth who have been exposed to violence are more likely themselves to engage in violent behavior, commit crimes. And as a juvenile prosecutor and a defense attorney as well, oftentimes I saw that with the young people that I was working with, is that some of the behavior they were exhibiting, it was things that they themselves witnessed in their homes, in their communities, or situations where they were victims and had certain types of behavior perpetrated on them. So all of our research say that our children that we're working with and the families, oftentimes these are children and families who have themselves been exposed to some degree of trauma. And of course, when we talk about cases in the child welfare system, these are the cases involving abuse and neglect. Well, by its classification, we know that those children definitely have been exposed to some form of trauma within their lives. So when we look at the child welfare system just a little bit deeper, what we know is that referrals have gone up. So that's the good news, that more people are comfortable reporting suspicions of abuse and neglect. And so we want more people to speak out. And so we definitely have seen a rise in the number of reported cases to the child welfare agencies throughout the nation. And at the same rate, we've also seen a decline in the number of confirmed cases of abuse and neglect. So it's good news in the sense that we're seeing more referrals being made to the system, but also we're starting to see a decrease in the total number of confirmed cases of abuse and neglect. Now, I will tell you, as you see the numbers on this slide, we're still nationally seeing over 500,000 children in our country with confirmed cases of abuse and neglect. And so it is indicative, or it suggests that there's still a lot of work that as a nation we have to do to ensure that our children can grow up in thriving homes where they're not being subjected to physical or mental abuse. So we still have some work to do as a nation. And what is the impact for the professionals? Brooklyn, this will be a good time. I'm curious to know, of those of you attending, what is the nature of the work that you're doing? So let's take a quick second. And the question is, what is your field of work? And do we have the options, Brooklyn, for them to select?
Yes, I just launched it.
Okay, so we'll take a few seconds just to see who's actually in our audience. Do we have nurses? Do we have doctors? Do we have lawyers, social workers, school teachers?
So far, the highest response is public servant.
Okay, public servant.
Yeah,
Okay.
so we have public servant, we have education administrator, child welfare professional, therapist, public servant, five out of
Uh,
17.
okay.
Yeah, private
Okay.
sector, a few folks in there.
Okay, good. Well, that's what I wanted to know who we're speaking. So we can go ahead and close the poll out. Thank you, Brooklyn.
Hmm.
So it's important to understand that for those of us who are working with children and families in the court system, that the trauma also has an impact on us. Um, I wish on the front end of my professional career as a prosecutor, juvenile prosecutor, I had more awareness of the trauma-informed approach because I can recall specifically one of my staffers who came into the job very energetic, very passionate about making a change. And this individual stayed with us maybe about 2 to 3 years. And on the end of that time with us, she completely changed. And I didn't know if she was just disgruntled, if she had personal things going on. Well, now at this stage of my life, what I realized is that the nature of the work that we were doing, it's the secondary trauma that we as professionals can also be impacted when we're working and servicing the young people. And this goes beyond the court system. Our teachers who are working with children in the school setting who are coming to school with trauma. And so it's really important for us as the professionals to have an understanding of what trauma is and that we're going into the workplace with approaches on how to service the children and the family and also take care of ourselves in the process. So this is why it's important to know the impact on us as the professionals. So I thought to help you better understand when I say juvenile justice system, what I'm talking about, because it can look a little bit different depending upon what part of the country you're in. So all states have a system to deal with delinquent youth. And historically, there was a time where children were treated the same as adults. But in the early 19th century, as we became more evolved and research showed us that the child brain is different from the adult brain, you began to see states separate children from the adult system. And so Chicago was actually the first town to actually create a juvenile court. And from there, we began to see all other states separate children from the adults. And so we now have juvenile courts. Also, when I say juvenile justice, I'm also speaking of the child welfare system. And that is the system that addresses complaints of abuse and neglect that are perpetrated on children. And so the focus in those cases is to first and foremost protect the child and then try to put in services so that you can either preserve the family with the child back in the home or put that child in a situation where they can have permanency in perhaps another home. And so, of course, we are talking about foster care and adoption. In some states, all of this is handled in one agency. It's kind of like the umbrella approach where one agency will handle both child welfare, delinquency, status offenders. And so it could be a little bit different. And the research shows that when you have everything under one agency head, it makes it easier to coordinate services between the different systems because a lot of times what you will see is that the child who has been abused and neglected may also be a child who is engaging in delinquent behavior. And when I say delinquency, all I'm referring to is that by law, when a child commits a crime, we call that a delinquent act. And the reason why we make a difference in how we term or phrase the behavior is that children have a higher percentage of rehabilitation. And so we don't want to stigmatize the child by calling them a criminal. So we refer to the behavior as a delinquent act. So when I say delinquency, I'm talking about children who are violating some state or city crime or are engaging in criminal behavior, but we acknowledge that it's a child. So in some states, in half of the states, basically you're going to see the delinquency and the child welfare cases all under a same state agency. Louisiana, we're a little different, but not too different. In our state, we actually have separate state agencies that handles the child welfare piece. And then we have a separate system that handles the delinquency aspect. And both the delinquency and the child welfare, these are matters that all fall under what's called the Louisiana Children's Code. So in our state, we have a separate set of laws that specifically address children in the court system as either a delinquent or a child in need of care or a child of a family in need of services. And so I briefly mentioned to you that we have a separate state level centralized system whereby the Department of Children and Family Services, they oversee all the child welfare matters in our state. And then we have another state agency called the Office of Juvenile Justice. That system is involved in overseeing the rehabilitative services for children who are deemed to be delinquent and either require some form of services within the community or services in state's custody when the child is removed from the home to get more in-depth rehabilitative services. Now, also at the local level, there are jurisdictions who parishes and cities, if they have the funding, they are able to deliver some of these services at the parish or city level. So you may come from a jurisdiction where in your city, there is a Department of Juvenile Justice. I'm thinking, for example, Caddo Parish. Caddo Parish and Calcasieu Parish, EBR Parish, Orleans, these are parishes that specifically have a juvenile justice at the local level that is able to provide services. And there are others in our state as well, but I'm naming those in particular because they actually have separate court systems that are solely focused on juvenile justice matters. And so again, the Department of Children and Family Services, they investigate abuse and neglect cases. They're able to deploy resources and services to work with children and families to restore the harm and help the family to be in a healthy place where the child can be safe. And then the Office of Juvenile Justice side, that is to help protect the public and to work with children who need rehabilitative services, who have engaged in delinquent acts. And I just wanted to kind of set that so you understand when I say juvenile justice, what I'm speaking of. Generally, these are matters whereby the individual is under the age of 21 So in our state, at the age of 21, there are certain rights that one will have. 18 is the age of majority in our state, but 21 is identified as an true age of adulthood. Someone who's 18 and technically of the age of majority, that individual could still be in school. So when I graduated from high school, I was 18, so I was still in school up until the age of 18. And so our system works with children anywhere from age 0 all the way up to their 21st birthday. And at 21, the jurisdiction of the juvenile court system ends. Now, in our state, if someone is 17 and they commit a crime, by law, they are treated as an adult. So you may sometimes hear a 17-year-old, 18-year-old, 19-year-old commits a crime. Well, they, by law, are going to be participants in the adult system. But our juvenile court system, it does allow the system to work with someone who, at the time of the commission of the crime, was still a minor to deliver services until they reach their 21st birthday. And I know that can be kind of confusing, but I want you to know that our juvenile justice system will actually work with an individual all the way up to their 21st birthday. And that also applies on the child welfare side. Louisiana, a few years ago, extended the age of foster care to a person's 21st birthday because studies showed that even at the age of 18, most young people still could benefit from having the support. And so if you think of your own children who have gone to college, even though they're 18 and 19 or 20, as a parent, you are likely still supporting your young person or being a support system. Even if it's not financial, you may still be a support system. And so it's good that we have a system that recognizes 21 is probably an age where you may still want to, below 21, you may still want to be able to be there to support the young person. Now, the last bit I want to say about our children's code, and I say this in every occasion I get to speak about Louisiana law when it comes to children. Our law clearly says that the focus is the preservation of the family. That's in the preamble of the Children's Code. And there's a recognition that preserving the family is essential to having a free society, that the relationship between the child and the parent is a preeminent relationship. There are well-recognized constitutional rights, and that when the state intervenes in a family's life, it should only be in extraordinary circumstances, emergency circumstances, that we don't want the government to overly intrude into a family, because everyone has the right to raise their family as they see fit. But we also want to make sure that children are safe and protected. So how I chose to raise my children could look a lot different from my next door neighbor. And we both should have the right to raise our children as we see fit. But we also want to make sure that in doing so, we're not harming the child. We're not inflicting harm on the child. And so the government can only intervene when there is concerns that the child is not being raised in a healthy and safe home. Under our children's code, there's a lot that happens. So there's services to families, there's child in need of care proceedings, there's services for families who are found to be in need of services. We talked about the delinquency aspect, but there's also adoptions that occur under our children's code. Parents are able to surrender their parental rights. Parents' parental rights can be terminated. Children can be adopted under our children's code. There are other additional supports for families. children with specific mental health needs, their rights are recognized under the Children's Code. And then the last section I'll just briefly mention is that even how children from other states can receive services. So, for example, sometimes when children run away, they can end up in a different state. And there are laws on how the states are to work together to make sure that child can be safely returned back to their home. So it's a very broad law that makes up Louisiana's juvenile justice system. And that's what we're going to kind of cover today when we talk about the juvenile justice system. Briefly, let's talk about the stakeholders, all those who are involved in the juvenile justice system. Of course, the nuclear family, parents, biological relatives, school system officials, healthcare administrators, our law enforcement community. There's the legal aspect. So you got judges, prosecutors, defense attorneys, probation and parole. You have our child welfare system workers, community providers, so group homes, counselors, therapists. There's that detention aspect where when children have to be detained, there's a system throughout our state that's a part of the juvenile justice system. There are the community advocates who are constantly ensuring that the system is working as it should. You have the community, and then you have state and local governments. So there are a lot of stakeholders involved in Louisiana's juvenile justice system. And the last thing before we really get deep into our conversation. So I'm talking about the juvenile justice system, but that in no way should cause anyone to think that only those children are exposed to trauma. There's a whole nother court system, the family court system, that deals with divorces and deals with child support, custody issues. That's a different system. And I do recognize that children in that system also may be exposed to trauma, and the professionals that work in those systems likewise could be exposed to secondary trauma. It's important to know that traumatic events are not isolated to just one segment of our population. We can see trauma in very affluent family settings. And so I don't want anyone to walk away from today's discussion to just simply think trauma is only seen in the cases in the juvenile justice system. No, trauma is a reality of our existence. And so that's just one observation I want to leave with you before we dive a little bit deeper into the trauma-informed approach. So when we talk about the trauma-informed approach, of course, we're talking about adverse childhood experiences. What we know from the research is that trauma can impact the child, and this impact can go on into someone's adulthood. And so it can have an impact on you physiologically, mental health-wise, it can impact your mental health, post-traumatic stress disorder, depression, suicide, substance abuse as a coping technique, and even trauma can impact one's lifespan. So we know that those who have been exposed to severe trauma, that their mortality rate can actually increase. And so the research is clear that identifying early on and putting in place services to address the trauma, the adverse childhood experiences, that it is very critical for one's own health. SAMHSA defines trauma as a result of events that can happen in one's life. It could be a series of events. So sometimes the trauma, it could be a one-time event. And let me give you an example. Someone is involved in a very bad automobile accident. That experience can cause trauma for that individual. So that would be a one-time traumatic event. But what about the child, the individual who's in a situation where every day there's something adverse happening in their life, in their household? So the child that is being raised in a home where there's domestic violence. Well, that's repeat trauma that that child is being exposed to. And so again, we know that these events can have a impact. Sometimes the impact is short term, but sometimes the impact can be long term. And so this is how SAMHSA defines trauma. And so there are three types of trauma that we kind of talked about. So there's the acute trauma, which can arise from that one significant event. There's the chronic trauma that occurs when an individual experiences repeated and prolonged exposure to trauma. And then there's also complex trauma. And complex trauma is the exposure of multiple traumatic events, often of an invasive interpersonal nature. And this is the trauma that we can see where there are long-term effects that impacts the child and the individual. And I'm speaking to you today not as a clinician, but as a practitioner within the legal system. So the first time I heard about ACEs, this was probably 10, 15 years ago. And again, I wish I would have known about this, even though I have a psychology background and I work with children early on in my career. And I knew about trauma, but I wasn't really well versed in the impact and the ability to study it and understand the modalities that should be put in place to try to help the person who's been exposed. But we all have had, if you do the ACEs test, it's a really good test to do. I haven't done it in a long time, but all of us have been exposed to something that's adverse. And I had a conversation with someone recently to say, even though we've all been exposed to something traumatic, depending upon the protective factors in your life, your ability to overcome that trauma can look a lot different. And so protective factors are, a stable household, stable income, positive adults in your life. There are things that each of us have that gives us the ability to withstand adverse events a little bit better. But as you start chipping away some of those factors, so if someone's living in an impoverished home, if they're living in a high crime area, if their home doesn't have a strong support system externally, then this can decrease your ability to handle the traumatic events that are happening within your home environment. So ACEs can help inform the way in which we as the professionals understand and experience and come up with decisions on how to work with the child and the family. SAMHSA also has 4 key elements of the trauma-informed approach. And so I like it. It's the 4 R's. So first of all, realizing the prevalence of trauma within our society. That in itself can be a big step in working with children and families and also taking care of yourself. Recognizing how trauma affects the individuals involved in the programs and the organizations that we work in, including the workforce. Responding, how do we respond? So we realize that trauma is everywhere. We recognize the impact that it has on the individuals, but how are we responding to that? What are we putting in place with our knowledge to help the children and the families? And then the last one is preventing re-traumatization. ensuring that we're not doing things that are triggering trauma. That is the trauma-informed approach: realization, recognition, responding, and doing everything we can to not re-traumatize. And so I'll give you a very quick example because I want to make sure we have enough time to really answer questions. One practice I instituted as a juvenile section chief prosecutor was when I had children as victims who clearly had been traumatized, we made sure that in preparing that child to be a witness in a courtroom, that we didn't do anything to re-traumatize them. The biggest thing was if you could resolve the case without having that child to have to testify, that's great, because now the child doesn't have to relive the bad stuff that happened. So there was an emphasis in trying to resolve matters without re-victimizing the child. But even when we had to have the children come in the courtroom and testify, there were a lot of things we did to minimize the trauma. Videos, if the child had already been, their events were recorded by law enforcement, well, we played the videos. And we didn't put the child back on the stand if we didn't have to, because we knew that the mere act of the child having to get in a room full of people and talk about what happened to them, that was a trigger, that was re-traumatization. And so that's just a very simple example of things you can do as a practitioner to minimize the trauma that the ones we're working with are experiencing. And all of us who are in this profession working with children and families, you've seen behavior that maybe you didn't realize at the time. Oh, why are you so angry? Why are you so irritable? Why are you so anxious? Well, trauma actually displays itself physiologically, emotionally. And so what we know is some of the behavior that we're seeing that may be deemed to be not appropriate for the settings, that behavior is probably tied to a traumatic occurrence or event for that individual. The flat affect, the inability to communicate, the empty gaze, the feeling of hopelessness and depression. These are all ways that trauma can manifest itself with the person. And I'm not just talking children here, because this also applies to our colleagues in the workplace. When we see our colleagues in the workplace engage in certain behavior that we're not aware of, well, why are you acting this way? Well, again, it could be from their own personal trauma, but also what we will talk about very shortly, the secondary trauma. So it's such a deep conversation, and I'm going to kind of go through some slides because I want to make sure we have enough time to really answer questions, but just a continuation of things that you may see from someone who has been exposed to trauma. So what is the trauma-informed approach? Doesn't mean you have to be a social worker or a clinician. It just means you have an awareness of the reality of trauma. And then you're taking that awareness and that knowledge and you're actually applying it in your job. And it really just starts with the assumption that all children and youth in our system probably have dealt with trauma or some type of traumatic event. And I'm intentionally going past that because I want to get to you as the professional. So the trauma-informed approach with the child and the family, we know that for children who are system involved, that it is highly likely that they themselves have been victims of trauma, and that even their caregivers have likely been victims of trauma. And so having that awareness can help you develop the right approach to interacting with the child and the family as you try to deliver services. Complex trauma may compromise the child and the family's ability to function. And so There's the understanding of the reward motivation system. This is essentially what happens in the brain and the body when you're trying to learn, pay attention, complete certain tasks. Well, trauma can impact that. There's also the impact on someone's tolerance system, how they respond, how they can tolerate certain things, and then even the ability to execute. All of this has an impact on trauma. And SAMHSA, again, tells us to remember the 4 Rs. And I see I'm right at 12:40, but I want to just kind of push through this because there's a lot. So what SAMHSA tells us is that in working with the youth and the family, let's make sure we have a safe environment, an environment that's supportive. You want to try to identify the level of trauma with the children. So having good screening techniques is very helpful. You want to provide your staff with trauma-informed techniques in working with the child and the family. And it's this last piece on this slide that I want to talk to before we kind of get to the part of questions. As you notice here, I am specifically saying it is important for us as professionals to recognize that the trauma of the children and the families, that can create what we call secondary traumatic stress on us as the professional. And so this is a good transition. I love this quote. We as the professionals, we have an obligation to our clients as well as to ourselves and our colleagues and our loved ones not to be damaged by the work we do. There were many times that in my household, we had the rule that there are certain days that dad is probably going to be a little isolated, not because I didn't love my family, but because of something I went through working with a family and a child. I needed time to kind of process that and not bring that into my family setting. And so we had a rule in our house, dad's going to the man cave to watch his movies because that's his way of being able to get to a better place. And so it's really important for you as the professionals to be aware of secondary trauma, the burnout effect. What we know about secondary trauma is that for therapists who work in this profession, you are highly likely to have STS, secondary trauma. Anybody that works directly with traumatized children and you're in this position where you're constantly hearing these traumatic events that happen in that child, that's being absorbed by you as well. So it's really important for us as professionals to know, just by the very nature of our work, we are likely to have this secondary traumatic stress that could become a part of us. And you don't want that to impact your ability to deliver the services that you need to deliver to your client. So as we kind of wrap up, what I want you to know is that there are techniques that can be employed in the workplace. And for those of you who are on that are managers, directors, administrators, principals, even if I got somebody on the school board that's here, there are things at the organizational level that should be put in place for your staff. Having clinicians who are available to work with staff is very beneficial. Making sure we have appropriate caseloads for our staff. We don't want to overload them. And it may even be important to make sure that you're not loading one staff member with all the cases that have so much trauma in it. You maybe want to disperse that. You want to have self-care within the workplace. Perhaps you offer flex time with work schedules. You definitely should try to incorporate secondary trauma stress training within your workforce. You probably want to try to create some external partnerships that can help you with your team and your staff. You want to make sure your leadership has a good understanding of trauma. And you always want to have some type of ongoing assessment to ensure your staff is healthy. And Brooklyn, I see you coming on. I'm going to kind of wrap it up with this last piece. As the individual, make sure you're maintaining your own well-being. Be aware of your own limits. Um, Exercise is good. Staying connected, engaged. So again, I'll use myself. My family knew that there were times where I did need that personal time, but then they also knew we want to make sure dad is re-engaged back in the family setting because that's good. And so being aware of your own needs is very important in this profession. So there are a lot of tools out here, folks, and Ms. Gail, I did jump, so I'm sorry about that, but I wanted to get to this one thing. Just be aware that there are training tools that are accessible to all of us. In this day and age of AI, all you have to do is go on the internet and just Google trauma-informed approaches. I had the benefit of really getting some in-depth training through the Karen Purvis Institute at TCU. Here in our state, there are trainers who have been trained on trauma-informed techniques who can come into your settings and work with your team to really deploy some good techniques that will help you, help your clients. And so some of this training is 1, 2 hours, some of the training is a day, but then they even have trainings that are like 12-month trainings. So look, this was a lot we went through today. As I close, I guess my takeaways are just, it's important to pay attention to yourselves and the people that you're working with, the clients. It's really good to take a step back and broaden your own understanding. I'm constantly educating myself on trauma and the impacts of trauma. And one of the things that can help with staying on top of the latest trends is be curious, be open-minded. Weigh out your own decisions. I try to approach the work with a trauma-informed lens. And again, the last piece is stay attuned to yourself. Know your limits and be comfortable speaking about your limits so that when it's time for you to step away to repair yourself, that you're able to do that. So a lot of information, folks. I'm happy to answer any questions. I did provide our partners with WHL some materials, and Brooklyn and Liz, feel free to share those materials. One is the impact of secondary traumatic stress on the professional, and then the other one is materials on trauma with the child. And of course, you can have access to my presentation so you can go back and review that at a later date. So thank you all for your attention, and I'm happy to answer any questions we have as we wrap up.
Yeah, thank you so much, Carrie. This was an amazing conversation about this issue. I do have a question in the chat. It's more so a comment. Someone was saying that the Louisiana Childhood Adversity Resilience Education, which is the LA Care Network, is a local resource to learn more about trauma-informed care. I copied that information in the chat. We have another question. It says, from your experiences, what patterns have you seen among youth who enter the system because they've run away? What tends to be going on in their lives?
Oh, that is a great question. So the biggest one that was always concerning was trafficking. We saw a lot of children who were being lured away from the home by a trafficker. So that's a real thing in our state. And then I would say probably the most common factor was violence in the home, domestic abuse violence, or even violence being perpetrated against the child. And so when children are running, because a child's natural instinct is they're nesters. They want to be close to their family. And so when you see children who are leaving the home, that's a distress. They are actively trying to remove themselves from behavior that is undesirable. And so I would say probably the biggest would be violence being perpetrated against the child. And then the secondary one would be the kids who were being trafficked.
Awesome. Thank you for answering that. We have one more question. It says, great presentation. My wife works in child psychology, and we talk about the challenges that families have in their kids functioning in a society with high behavioral needs. What type of resources should the families look out for who are working through behavioral needs in their kids and want to keep them out of negative experiences with law enforcement?
Oh, yeah. Oh, great question. Look, I'm old school. Pro-social activities is just something that can help put a child in a safe, nurturing environment. And so I would say that if you're working with a family that has services, definitely look in your community resources for what I could say are the traditional therapeutic services. But some of this is just having something positive to do. So sports, being active in sports can be wonderful. Arts, having a child who's engaged in art. So whether that's dance, whether that's drawing, um, those pro-social activities can really help nurture the child and help the family as well. But that is a great question. And I wish I had time to just really go through a whole list, but there are a lot of resources in our community. The one thing that I found, and definitely when I got at the state level, sometimes you hear, well, we don't have services in our community. No, every community has resources. And it's just really important for us as the professionals that as we come across these resources, that we have our own list so that when the families come to us, we're able to refer those families to those resources. In my office as a juvenile prosecutor, we as the prosecutors, we kept a resource manual that we were able to have at the ready so that when we wanted to refer a family away from the system, but we wanted to make sure they got something to help them, even as a prosecutor, we had our own resource book. So for you as working professionals, I definitely think it is always beneficial for you to have a list of providers in your community that you can refer those families to. Great question.
Okay. Since trauma within the home can be difficult to prevent or address directly, what intermediary safeguards outside the home, such as school, health system, community organizations, are most promising to address issues that may lead to involvement in the juvenile justice system? And then a second question with that is that how can the state strengthen them while still respecting family autonomy and civil rights?
Oh, wow. That is a beautiful question. Thank you for that. And just the question in it itself should help all of us understand there's so much more we can do. This is my thought at the state level. By law, all children have to get an education and not putting any additional pressure on our teachers because they do so much. But I believe more resources to the school system to ensure that our frontline teachers have everything available to them to be able to properly educate the child. And so there are instances where the teachers can't do that because now there are behavior issues that are coming into the classroom. And just making sure that there's good alignment between our educators and our service providers in the community, it would be beneficial in having that organization. And so I'm very impressed with our current superintendent. He has a very good heart and he wants to see our children thrive. And to that last part, protecting the rights of our children, that is so important. And so it's a long-winded way of me saying, boy, if we could just make sure children are able to live in safe, healthy communities, that they're able to thrive in their communities, and that ability to thrive in their homes then translates to their ability to thrive in the school setting. If we put more resources on the front end, it will make such a difference in the outcomes for our children. I'll say this last piece. So I was once a secretary over the Office of Juvenile Justice, and I constantly would tell the legislatures that if you would take those same dollars that you're now using on the back end when the child has gotten into trouble, if you would take a half of that, maybe a third of that, and invest it on the front end with those children, we would never see these kids. Children, and I use the word bad, and please don't over focus on that word, but children aren't, they don't come out saying, I want to go out and do crimes, or I want to run away from home. Children are only seeking love. And so when our children start engaging in behavior that is antisocial behavior, that's the indication that something's wrong in their life. Something's not happening that needs to happen. And so, to that wonderful question, what I would say is if we put more positive resources on the front end, so many of our children would avoid the juvenile justice system. And remember, when I say juvenile justice, I'm talking about everything: child welfare, delinquency, status offender. So I just believe more investment on the front end, our tax dollars on the front end, would really help so many of our children and families.
Great. We have time for two more questions. One question is, why are so many students being given medication for behavioral issues in elementary school?
Great question. And quite honestly, we're an over-medicated society. Um, I my personal opinion is that medication has become a quicker way of addressing behavior as opposed to perhaps using some of the more engaging hands-on techniques. And when I say hands-on, I'm not talking abuse. I'm just saying spending that quality time with your children to help them develop their own coping skills. Medication is a quick way of, hey, you're anxious, so let's just give you a pill for that. Versus, hey, you're anxious, well, let's go outside. Let's, as a family, do something to help you ease yourself. So yeah, I just think medication has become a quicker, easier way to deal with things. I I was born 1969, so that makes me Generation X. You know, I often tell some of my colleagues, I don't remember so many kids having ADHD or ADD when I was growing up. We had kids in the neighborhoods who we would identify as being, I don't know, anxious, but not to the mass number that I believe we see now. So unfortunately, I think a lot of it's just where we are as a society and the ease it is to just write that prescription to deal with the behavior. Great question. Great observation.
Yeah, absolutely. And as we wrap up, I just want to also just thank you again for coming and spending some time with us and speaking to us. This information was definitely beneficial to our audience. Again, I want to remind everybody that we do have the three documents that he shared, some resources in there. We have his PowerPoint in the chat. And then also, Curtis, would you like to share any other final things or like where people can contact you or your contact information?
Well, only thing I'll just close with this. Thank you all for everything you do. Definitely, the Blanco Center, you folks do some great work over there. But for all of our attendees that are working with the families, I just want to say thank you. It's hard work, but it's needed work. And just I encourage you to continue what you're doing because we need good folks to continue to help those who are in need of help. And don't forget what I said. It is really important that you take care of yourself as well in order to be able to be the best service provider that you can be. So thank you all so much.
Thank you so much. Y'all have a good afternoon. Thank you. Bye, everybody.
Bye.